Hi, good evening everyone. I am Dr. Minal, Consultant Endocrinologist, Manipal Hospital, Jaipur. I am in Lucknow at present to attend the conference of International Blood Pressure Meeting, that is BPCON 2022. The talk that I am supposed to deliver in this meeting is how to manage diabetic hypertension. First of all, we must know that diabetes and hypertension are the two partners in crime. Both of them put together can create havoc in the life of our patients. Mostly they affect the cardiovascular system and the vascular system in general. So we need to control both the blood glucose as well as the blood pressure. We recently have the JNC 8 guidelines which have liberalized the targets a bit. So nowadays the recommendations are that you can manage your diabetic patients at a target of 140 by 90 millimeters of mercury of blood pressure. And the drug that is most commonly recommended by all the bodies, national as well as international, are either the ACE or the ARBs. So we are targeting the RAS blockade, that is renin-angiotensin-aldosterone axis. As we all know that the RAS system is activated and that is responsible mainly for hypertension in diabetic population. Even in type 1 diabetic children, you will find that almost 30% of them are hypertensive by the end of first 5 years of diabetic diagnosis. And in the case of type 2 diabetes, most of the patients are already hypertensive right at the diagnosis. So we need to control blood pressure very aggressively, and it's mandatory to keep the blood pressure below 140 and 90. And how do we do that? We have a bunch of molecules with us. But the first line therapy that has been recommended is either ACE or ARBs. ACE inhibitors are the molecules that go and block the angiotensin 1, and the ARBs are the molecules that block both angiotensin 1 as well as angiotensin 2. So they give us a complete RAS blockade. We have a new molecule in the pipeline which also acts at the RAS system, and that is a direct renin inhibitor, that is elacestrant, and we will soon have that also in the market. Besides the ACE and ARBs, we need another molecule because monotherapy in controlling blood pressure in diabetic population usually fails. So we need to give our patients the benefit of double therapy. And the second molecule that has been commonly recommended is either a diuretic or a CCB. So whenever you are prescribing your antihypertensives, make sure that you are keeping the patient in your follow-up, and whenever the patient comes for your follow-up, the most common side effect that you must look for is there is hyperkalemia, there can be angioedema, patient might complain of some mild dry cough. So if the patient is complaining of dry cough, think of switching over the patient to either ARBs or some other molecule. If the patient is complaining of some muscle cramps, then just go for one electrolyte investigation, and serum electrolytes might give you hyperkalemia. And if the patient is having hyperkalemia, combine your ACE or ARB with a diuretic, that is a potassium losing diuretic. Then if still the blood pressure is not controlled, you can think of adding a triple molecule, that is a calcium channel blocker. So besides controlling blood pressure, the next line of management has to be that the blood glucose has to be tightly controlled, the total cholesterol has to be tightly controlled. So give the benefit of a statin, and also we always recommend one ecosprin or maybe a clopidogrel, that is we need to have a platelet stabilizer also, that is a platelet anti-aggregatory molecule. So that gives the complete metabolic management of a diabetic hypertensive patient, that is a good blood pressure control, good glycemic control, along with a statin and along with an antiplatelet drug. We must never forget the therapeutic lifestyle recommendations. So we must always recommend our patients to follow a healthy lifestyle in terms of a healthy diet and a regular exercise. So 30 to 45 minutes of exercise every day, and a lot of green vegetables and fruits, and a healthy lifestyle has to be followed along with our medical management. Thank you.